Welcome to Recovery Corner, where the many pathways of recovery intersect. This is a space where you will hear personal stories of triumph in recovery, gain insights into various recovery-oriented systems, and learn how leaders across the country are building recovery-ready communities. The Recovery Corner podcast does not provide clinical advice. Hello, friends, and welcome back to Recovery Corner's Recovery Corner. We've got all of the usual suspects here with us today, so let's just get right back into it. Aaron, do you want to start us off?
Yes, I do. Okay, so today I want to talk about Recovery Month. And let's see, Recovery Month is or was launched in 1989 by SAMHSA. That's the Substance Abuse and Mental Health Service Administration. It's a long one. With the aim of increasing public awareness about mental health and addiction recovery. And so kind of just to provide some context, I was talking to a couple family members and friends, and they didn't know what Recovery Month was and when it was. And that was kind of curious to me, just because working in the space for a while, I thought everybody knew. So if you don't know, Recovery Month is held every September, and it promotes and supports like treatment and recovery practices. And the history of it was back in the day, a lot of underserved communities and just people that are impacted by addiction and mental health. There was no outlet. There was not a lot of recognition. And so many organizations would host special events and activities that would allow people to share their progress and their recovery stories. But there wasn't an actual like designation or a time or a focus. And so now, and in previous years, SAMHSA has come up with this month. So I would encourage you to talk about it. There's a couple of things. Specifically for our YPR folks and chapter leaders and members, like host an event. Another tangible thing you could do is attend an event. Another really good tool that we all have is social media and just literally talking about it, letting people know that this exists. Again, that's the biggest piece for us. And then one really cool thing that I was doing some research and I saw a lot of people, they encourage their local leaders to do a proclamation, and that just brings more attention to the issue. So it's on a very broad spectrum and level that anybody and everybody can know like what Recovery Month is. A last call would be to educate a friend and educate yourself. You can read more. Just Google Recovery Month. It'll take you to the SAMHSA website if you want to know more about the history, what people are doing around you. If you bump into this podcast, like on Google or on social media, just literally do some research and share it with a friend. So I would love to hear other people's perspectives. What are you excited about for Recovery Month? Okay, I guess the first question I want to ask is, when did y'all know that Recovery Month was even a thing?
Okay, so I'm a little embarrassed about this, but I didn't actually know it existed until I started working here. And that was in January. I'd already been in recovery for like a year and a half, and I had no idea about it.
Wow.
Thanks, Lex. Just wow.
Wow.
I
wouldn't have hired you if I would have known. No, I'm kidding.
Lex.
I'm totally kidding. That is surprising though. I also didn't find out about Recovery Month until I started working here. So there's that.
You can't make fun of me for that then.
I know.
Yeah, same here. I didn't know about it until I started working for YPR.
Yeah, it's a really exciting month. There's actually like a lot of really cool things happening, particularly Mobilize Recovery, who is founded by Ryan Hampton, who used to be like a YPR, who was one of YPR's founders. Is that right?
Yeah. He's still involved in our board.
Yeah, he founded Mobilize Recovery, and they tour the country hosting events, promoting recovery.
And a little plug, we've got a podcast episode coming out with Ryan Hampton later this month, so stick around for that.
Nice.
Yeah, we talk a little bit about Mobilize in there.
That's awesome. So yeah, I mean, that was one of the biggest things. I was like looking for things to talk about. And one of the biggest things for me is just the awareness of people in recovery and what Recovery Month can do. And I mean, just imagine if everybody that we knew about it. Like that's the start. Like literally saying, hey, did you know it's recovery month in September? And I think that will start, the trend of making this go a long way and impacting just mental health and recovery.
Mm-hmm. I think one of the most important things that people can do during recovery month, after that initial step of finding out about it and learning about it, is using it as an opportunity to platform your own voice, your own story. Because if several people do that, if we get participation in storytelling from a lot of people, others who are maybe not as involved in the recovery community or don't have very much personal contact with people who are, they're going to hear these things, realize that it's all different. There's not one story. There's not just one situation that can lead to somebody misusing substances, or there's not only one way to recover and get out of that hole. Like, storytelling is the most powerful tool that we have, and Recovery Month is a great way to take advantage of that.
Yeah, I fully agree with that and support that mission and call to action. We're seeing on social media, right, that videos are the kind of content that's being consumed and engaged with the most. And a lot of the videos are just these really authentic, hopefully, right? There's also some trash out there. But yeah, there's the really authentic videos of people sharing their stories and really inspiring change and awareness about causes that we didn't know about in the past, perhaps. Well,
so go educate yourself. Recovery Month.
Yeah. I'm gonna segue us into our next topic today, which is connected to this. So I want to define recovery because I think a lot of people don't even know what recovery is. And when people think about recovery, they think, someone that has struggled with a substance use disorder, right? Very specifically. And although that is the grand majority of the people who resonate with the concept of recovery, and who join recovery communities, I really love SAMHSA's definition of recovery because it makes it more accessible to a wider community, specifically perhaps the BIPOC community, which is where I'm going to talk about is this month. We're in July right now, is BIPOC Mental Health Awareness Month. And so talking about, mental health as a whole, we think about recovery as part of that too, right? So SAMHSA defines recovery as a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential.
Nice.
Yeah. I resonate with that. I'm a person in recovery. I am not a person that struggled with a substance use disorder per se, but I have had experiences throughout my life with substances that I've shifted and changed and become more aware of and improved my health and wellness and chose to live self-directed lives and not live a life where my life revolved around a substance, right? And those are conscious choices that I made in order to strive for my full potential. So I am in full resonance with this definition. And I am a Latina. I am a person of color. I grew up in Honduras, and mental health within the Latino community and also recovery substance use within the Latino community is highly stigmatized and not a topic that we talk about often, which then leads to people not accessing the treatment that they need, people not talking to their friends or family or community about the struggles that they're having, which then we're noticing, and I wish I had this data point and I can pull it up, but a high amount of overdoses happening within the Latino community because these conversations are just not happening. And so I do have a data point though here on only 37.1% of Black African-American adults, non-Hispanic, and 43% of mixed multiracial adults, non-Hispanic, seek treatment for mental health conditions compared to 51.8% of white adults, non-Hispanic. Where is the Hispanic data on that? Anyways, just like also like a point of recognition, right? Of understanding like what the level of access or not accessing mental health treatments and also substance use treatment within our BIPOC communities. For those who also don't know, BIPOC stands for Black, Indigenous, and People of Color. I shared a little bit about my experience being Latina, and I'm happy to share more about that. I'm curious about, what other perspectives you all have to share or data that you may have on this topic as well.
I really like that definition. I think it's also encompassing of other behavioral health problems, right? That aren't necessarily substance use disorder. So, and I think sometimes in the recovery community, people might feel a little hesitant to join just because maybe they haven't specifically suffered from a substance use disorder, but they still resonate. Yeah, very interesting.
Yeah, and I actually know I've heard from some of our chapter leads that there are people who come to their meetings and they're struggling with, say, recovering from an eating disorder or with gambling. Even though YPR is focused on drugs and alcohol, there are other people that we can bring into the fold because at the end of the day, it is a space to find compassion, community, support, and that can be applied to basically anything.
Yeah. And I found that data point. So 35.1% of Hispanic Latinx adults with mental illness receive treatment each year compared to the average of 46%, which is still slightly lower than I think it maybe is or should be post-pandemic.
Mm-hmm.
What are some ways that you all support your mental health, just in general, as we have mental health awareness as a whole too?
I'm a huge proponent of art therapy. Even as like a kid, like that was like the way that like social workers got through to me. It was like finger paints and like things like that. And so even as an adult, I've shifted to like really trying to find time to, well, not find time because that doesn't work, but like to carve out time to, create things because it brings me joy. You know what I mean? And I think that thing can be different for everybody, but yeah, that's mine.
I love that. For me, it's music. So kind of an art, but music. I
Yeah.
love just creating and being inspired. And yeah, I think also some physical like exercise is another good one that I'm starting to get into that I did not know that I needed. And I'm like, oh wow, this is kind of the healthy missing link. I tend to run to food. So I'm like, this is great. Yeah, those are two for me.
I like to get outside and be active outdoors. I'm lucky to live in Denver, Colorado, so there are mountains right in my backyard. And yeah, I was just telling Erin earlier that I went caving with my dad this weekend. Like, I just like getting outside, doing new things, and feeling adventurous and getting the sunlight on my skin. Because I know a lot of people see self care and taking care of your mental health as slowing down and relaxing and taking a break, but I get bored if I relax. So that's not a good strategy for me personally. It works for a lot of people, but that's not for me.
Yeah. I agree with that actually. I get kind of bored when I'm idle for too long, I'm like, because I can also entertain myself. Like I love reading. I love relaxing. Like I actually love the act of doing nothing, of just like sitting and watching my surroundings. And so, but I noticed that like if I do that for too long, like I'm excited for the week to start so that work starts again, and granted I love what I do, but that's like I'm like excited to do things, but I also need that like turn off time in order to be activated for the what the week brings. And then I think that physical movement is just so important for mental health as a whole. I love dancing. And so dancing is definitely how I take care of my mental health, whether it's dancing around in my apartment by myself, or I go to this thing called a static dance, which happens a couple times a week, I guess, here in Denver. And it's just like free movement, like free expression, like do whatever you want in a space with a DJ, and it's like a sober dance party essentially, right? But it's more intentional and ceremonial, and because it opens, like there's like an opening circle and a closing circle. But I find a lot of healing through this, and also nonverbal, so you can't really talk to people on the dance floor. So I find a lot of healing in a space that's like really encouraging me to just be in my body and like move with my body and like figure out like where I feel stuck and why I feel stuck, and like just process my thoughts and my emotions in this really safe space. And I've been going for 5 years now, and so then it turns into this like sense of community, right, that exists, that's just kind of built in community because I've been going for so long. Um, I also find a lot of I guess like supporting what supports my mental health as a Latina is connecting with music and connecting with Spanish music and dancing, right? Like connecting to my cultural identity makes me feel more whole. Like whether that's speaking my language, right? Whether that's like talking to my friends or my family members, again, like listening to music, looking through pictures sometimes. I'm not to mention going to Honduras and actually spending time in my country, like where I grew up. Like, and I found some research in the past that supports how like your connection with your cultural identity is a protective mechanism for substance use disorder or substance misuse, right? And specifically in adolescence, or like when kids are going through their like these key developmental phases in their life where they're developing their identity and like sense of intimacy and community and connection, having a strong cultural identity serves as a protective mechanism.
I think I've read that too before, and that makes a lot of sense that because connecting with your culture could build community and make you feel like you're a part of something and you're connected to the earth or your ancestors or whatever it may be. And I can see how that would have a big impact on someone who may otherwise feel somewhat isolated, especially if they do not live in an area that has a big cultural community that they can relate to.
I think it is my turn. So I am really excited. I want to talk a little bit about a new policy that I think YPR is going to be promoting uh, in a more like, well, it'll be really interesting. But I really want to talk about this because I think it's fascinating. So this is called the Reentry Support Through Opportunities for Resources and Essentials Act, which is just Restore. It's the Restore Act. And basically all it does is that, I don't even know if most people are aware of this, but if you are convicted of a felony in the United States, you just aren't eligible for food stamps anymore, the SNAP program whatsoever, after you get out. And that's a really big deal, right? Because the SNAP program, it literally like, saves lives. So, like it's a really big deal for low income people. And so basically what this would do is eliminate that so that once a person specifically who has been convicted with, a drug charge, a drug felony, gets out of jail, that doesn't happen, so that they're able to access SNAP as soon as they get out of prison, which is like really, really cool. I'm very passionate about food insecurity. As a kid, I think a lot of people have suffered from food insecurity and like didn't even realize it. But like as a kid, we definitely like very much like rationed out food because the nearest grocery store was like an hour away. Like that kind of stuff was real, right? And I think that's the case for a lot of not only kids, but a lot of like adults in America, right? And I think, especially when we look at the prison system and we see the disparities already there, and we see how skewed the population is and all of this, it's just creating more harm in these communities and really just continuing this cycle of poverty and pain and all of these awful things. And so I think this is like, as small as it sounds like, I think it'll really, really, save a lot of lives and help a lot of families on their road to like healing through these difficult times,
Yeah, I totally agree. And I was also reading about this, and I think it's important to also point out that keeping people away from food assistance programs is not backed by evidence at all to be a deterrent to future crime.
Mm-hmm.
It's literally just more punishment after they've already served their time and gotten out of prison. And what's the point of that?
Well, if anything, it also activates their nervous system and they're like, right, their sense of panic, right, that they're going to be existing in. Because if we think of like Maslow's hierarchy of needs, right, like that sense, food and home, like, right, being that first level of like stability in order for you to be able to do anything else in life, trying to figure out how you're going to eat every day and how you're going to feed your family every day. I mean, that's not helping any kind of individual or system.
Yeah, I agree.
Go ahead,
It's pretty
Aaron.
crazy that was even a bill. Like reading that, I was like what? That's nuts. I mean, you're starting from the bottom, right? Like and there has to be a level of grace and rehabilitation. Like there has to be a process to be able to start from somewhere, and if you eliminate the 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 access to food, like that bill just blew my mind. Like,
Yeah.
why did that exist? It's
Yeah.
insane.
Right. And I think that I think a lot of us have been like raised with this idea that like the United States is like the wealthiest country in the world, and that like we we like very much remove ourselves from the idea of poverty. But poverty is a really big problem in the United States. Like as of I think like either May or April, it was officially declared the fourth leading cause of death in the United States.
Oh,
That's
What?
crazy. Poverty itself is now the fourth leading cause of death in the United States. That's crazy. Like that's a big deal. And like I think obviously it contributes to not only developing a substance use disorder, but a person's ability to recover from that substance use disorder and to live in recovery, right? Like this this is such a big deal, and I think it's something that people are becoming more aware of. And so hopefully as that like cultural awareness grows and we're willing to admit like, hey, this is a problem and like people are suffering and like there's a big deal, this is a big deal, hopefully we'll start to see more policies like this that just like erase some of the harm that has been already caused.
Yeah, and the bill that's currently in place that the Restore Act is trying to overturn, like it just perpetuates the cycle too, because it prevents their dependents from being food secure. If their parent who just got out of prison can't get food for them, they can't get food for the family. So then it's just starting the cycle of poverty over, and it increases the rates of recidivism for the parents, and then the children who are growing up in poverty are more likely to fall into substance misuse or other kind of behavioral or mental health issues, and it's just helping nobody. Genuinely, it's helping nobody.
Absolutely. Absolutely.
Not to mention if they're not accessing food, right? They're not accessing food in general, but then what they are accessing is the lowest quality food available, right? Because they don't have the budget. And then there's a lot of data around how our gut health and our microbiome affect our mental health, right? And especially when you think about a kid in their developmental stages again, and how that's affecting there's connections between like poor gut health and ADHD, right? And Meg, did you recently talk about or mention how there's like a connection between, oh no, it was bipolar disorder and substance use disorder? But I wouldn't be surprised if there's some studies out there that also connect or correlate, right? ADHD with a like as a higher risk for
There absolutely are. Kind of jumping off that topic, I have looked into the ADHD connection with substance use disorder, and one of the symptoms of ADHD is impulse control just not being as strong. So, and like there's more of a need for instant gratification as well. And both of those things, especially in conjunction, can lead to a substance disorder, make it more likely, make it harder to stop once you are using. So ADHD absolutely has been shown to make life more difficult when you're using substances. Well, if that's all we have to say on Saraiha's topic, I guess I'll jump into our very last topic of the day. So today I am going to be talking about buprenorphine. So real quick, little background on buprenorphine for anybody who may not know is that it is a form of medication-assisted treatment, which is another path of recovery. A lot of people will take medications to support their treatment and make it easier for them to go through recovery and live more fulfilling lives. So what buprenorphine does, buprenorphine, it's a bit of a tough one to say, it's a bit of a mouthful, but what it does is that it is an opioid, but it doesn't provide a high, and it lasts a lot longer than, say, fentanyl, heroin, these short-acting drugs. So when people take buprenorphine, their drug, the receptors in their brain that receive opioids are full for a long time of the buprenorphine, so they don't have withdrawal symptoms. They don't have the urge to use other opioids because their brain feels full, it's satisfied. So it's really helpful. It's honestly like the gold standard of treatment. That's how it's considered by a lot of professionals and experts in the field. But recently, a study came out showing that the vast majority of treatment centers that serve adolescents, teenagers who are under the age of 18, don't offer it. Only 1 in 4 treatment centers who are serving teenagers offer buprenorphine. And buprenorphine is also the only MAT drug that is approved for people who are under the age of 18. So considering the fact that it's like the best form of treatment, it's the most effective, why aren't these kids being given the best shot at recovering? It doesn't make any sense to me. What do you guys think?
I feel like this is like partially like a cultural thing right now, that we're like very focused on like this concept of parents' rights, which like obviously, yes, like no one wants to like overstep and like upset a parent, right? Like nobody wants to do that. No teachers want to do that. No school nurses, no like treatment center professionals are the same, right? Like they also don't want to accidentally overstep and upset a parent. But I think sometimes that fear overrides what's best for the kids, like especially when we know like medically and evidence, like we have all of this massive body of evidence, right? And we know, hey, this is gonna help, right? And we also, I think sometimes parents don't think in the long term about like, okay, how will maybe not getting the proper treatment for this condition affect my child's long-term health and long-term success and well-being, right? I think they're thinking in that moment, right? And they just get very like, we can do this ourselves, like we don't need more drugs, you know what I mean?
Mm-hmm. And there's a lot of stigma surrounding MAT in general. People will say, well, you're not really in recovery, you're still taking a drug. It's like, well, it's not, you're not taking it for the pleasure of taking the drug anymore. It's medication. It's helping you live a better life. Honestly, that's what it is.
I think
Yeah.
there's a big stigma of, I mean, this in general, like even me, I'm like doing research before a call just to see like, hey, what are the risks? What are the positives? And so obviously with any prescription drug or any drug, not drug, but medication,
Mm-hmm.
there's risk, there's benefits, there's risk. And so speaking towards the parent angle, I'm not a parent, but like I would imagine just the lack of education around this issue, like probably the mass of people won't even know, right? Like they're going to hear medication, and then even how you explained it, I'm like, oh wow, like it is an opioid, but it's not, it's partially one. And right, like is there like cravings? Is there isn't withdrawal? Like is there any alternatives? What are the side effects? What are the, is it, some parents are like, yo, that's still an interaction with the drug, like there's just so much stigma, but also just a lack of education. And then that brings me back to us, our company, our organization, of really being the pushers and having this podcast to say, hey, this is super safe. Like this is an alternative and this is a way to treat. Yeah, there's side effects, but like the benefits are there, and this can be a useful tool. So there are parents listening, like, hey, this is an option for you. But yeah, I think a lack of educational awareness of what this even was is probably to blame.
I think especially within treatment centers, right? Because it's not, I mean, some people will take buprenorphine post-treatment as, like a mechanism to reach recovery or sobriety, right? And the intention of that is to minimize, decrease, remove the withdrawals, right? And I was just at the Rise 23 conference in Houston, which was focused on people in recovery who were formerly incarcerated specifically. And they talked, I attended one of the info sessions on specifically like opioid and opiate addiction. And one of the things that they mentioned, right, is like there's a difference between an addiction and a dependency. And so when someone is addicted to an opiate, they are craving it and they need it, right? There's a dependency in addition to a craving. There's a desire for it. Their dopamine receptors, their internal reward system is seeking it out. Whereas with buprenorphine, there's a dependency on it because it's it's allowing you to live a productive life, right? Someone is able to go to work and most likely stay focused throughout, you know, their work week, because it's reducing the cravings, it's reducing the withdrawal, so they're able to be a functional parent, functional adult, functional teenager, student, whatever they need to be in order to get through these daily, you know, cycles of life that they need to go through in order to reintegrate into society, in order to find the community that's going to help support their recovery, in order to find the activities, whether it's yoga, right, working out, dancing, listening to music, whatever it is that's going to support their mental health in order to get to that place. Unfortunately, without buprenorphine, it is very, 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 very difficult to be able to think of any other kind of thing that's going to support your mental health, because all that person is wanting, desiring, their whole biological, psychological system is telling them that they need to consume that substance. And so what buprenorphine does is that it quiets that voice.
Yeah, and that's what a lot of people need, of course, because withdrawal from opioids is painful, like mentally, physically painful. It's an awful experience. So if there's a drug, this buprenorphine, that can make that painful withdrawal go away, you don't have to go through it, that removes the biggest barrier for most people just instantly. Seems like a good thing to me.
Yeah, I agree.
But one of the things that actually upset me the most about this news story is that, what was it? It was 22% of treatment centers that do accept young adults and teenagers under the age of 18 would refuse to admit a patient who's already on buprenorphine. They're like, they cannot be on buprenorphine and then come into our treatment center. Like, what's the point of that?
I think that really speaks to like Lex's point of like people, even sometimes like treatment providers, don't necessarily always understand how this works and what this is and what it's meant to do, right? And that's such a problem because the people giving the treatment are the ones who need to understand it the most, you know?
Yeah. It's just really upsetting because, again, I think the most important thing is to give these kids the best shot at life that they could have. And for many people, buprenorphine is going to be a very important component of that. Not for everybody, but it is incredibly helpful for a very large chunk of people who are dealing with opioid use disorder.
I do wonder, so playing somewhat of a devil's advocate, if someone is newly experiencing an opioid addiction and they go into a treatment center, what are your thoughts on whether or not they should receive buprenorphine at that point? Or is there, or do we think that, I mean, none of us are medical professionals here. So, but I'm thinking like, right, like, would there be like a scale on what the quantity and length of use is in order to prescribe buprenorphine as an option? I don't know.
I mean, at the end of the day, that is up to like the care team, but it should always, always, always be an option.
Definitely.
Yes.
It's not fair to take the option at the like gold standard of treatment away from people.
Mm-hmm.
And
Yeah,
I don't actually know if there is some sort of time limit on how long you can or should be taking it, but I don't know. At the end of the day, I don't know if it really matters, as people should have the option.
Mm-hmm.
Well, and I'm curious about like some of the data around like those treatment centers and or like those cities, towns, right, that aren't allowing this buprenorphine to be within their centers, what the rates of overdose are compared to the treatment centers where buprenorphine are prescribed or allowed.
That'd be interesting. I don't know that data off the top of my head, but if I had to guess, I would imagine that buprenorphine lowers the risks because, like you said, I liked your wording. It quiets the voice, it quiets the urges, and it gets rid of the withdrawal symptoms. So people are much less likely to experience a reoccurrence of use. and go back to misusing substances and unfortunately pass away from that substance use.
Because their tolerance is less, or because they're hanging out with people whose tolerance is higher after, because so many different reasons, right? But
Mhm.
yeah.
Yeah, especially with youth. I think youth just like, you just dive in, right? Youth don't know how to like dose things or how to like measure things, right? And so I think youth are at even higher risk. Like if youth are already using substances and we already know this, then like this is something we want to treat immediately. You know what I mean? Because they are at the most risk.
Agreed.
Exactly. Yeah, well, kind of a bummer one to end off on, but hopefully the fact that this study has come out, I've seen a lot of different news outlets pick it up. Hopefully that inspires some kind of change at the very least.
Yeah.
Draws
I think it's
attention.
Absolutely.
great one to end off on because it's an incredibly educational and important for people to be aware of this subject as a whole. All of these subjects.
Oh, we all did a good job. We all brought important topics.
Yeah.
But yeah, in closing, going back to Saraiha's one, contact your representatives and tell them to pass the Restore Act.
Yep.
Yeah, do that. Do that.
Definitely do that. But yes, as always, this is only the second Recovery Corner's Recovery Corner. But like last time, I guess, I will link all of these articles in the show notes. You'll be able to go through, read them, form your own opinions. You're always welcome to message us on our social media channels about what you think. And if you want to hear about a certain topic, you can also message us and suggest it. And we like hearing from you guys anyway. So everybody have a good rest of your day, rest of your week, rest of your life. And we will all see you next month on the first Friday or first Wednesday. All right, bye.
Thanks,
Bye.
everyone.